Welcome back to our Strength Training for Beginners series. Today we're going to talk about the 5 most common mistakes people make when they're learning the hip hinge movement. So for such a simple movement, there are a lot of small things that can go wrong that as we progress the movement can cause bigger issues. So that's why it's so important that we focus on kind of correcting these small things now so that when you start to add weight or when you start to progress this movement, they don't become a bigger problem later on. So again, the hip hinge is a movement that I teach to almost everybody that comes into the clinic, and I've seen a lot of the common mistakes or reasons that people might be experiencing back pain while they perform this movement, and so that's why we're gonna cover it today. So, very first one we talked about in our previous video, but it's the difference between reaching our hips back, which is what we want to do with the hip hinge, versus bending the trunk forward. So if you remember that the hip hinge is all about reaching the hips backwards, and while this, bending the trunk forward, is still a hip hinge, your center of gravity gets way too far forward that if you were to try to lift weights or do anything from this position, you're going to feel it in the low back. So really make sure that that movement is reaching the hips backward. Number 2 has to do with our knee movement. So again, if you remember in that first video, I mentioned that it's important to start with loose knees and then reach the hips back versus locking the knees out and doing that kind of hip hinge. But what can happen when people are focusing on kind of like allowing their knee to bend is that they bend their knees too much and it becomes more of a squat, which is a different movement. So it ends up looking something like this. So this is more of a squat where this is the hip hinge that we're looking for. So again, a hip hinge is reaching the hips back. A squat is getting the hips down. So that's what's hard with the knee, is you want to allow your knees to bend, but you don't want to actively bend them. So I know that sounds weird, but it makes sense. So again, loose knees, again, you kind of allow them to bend. So I still have a little bit of knee bend as I reach my hips back, but I didn't kind of actively bend them into a squat. So that's the difference there. Again, very subtle, but very important. The third, again, one we mentioned in the previous video, but it's when people go too low. So that's where this pull comes in handy. But if I start with loose knees, reach my hips back, for me, this is about the limit of my hip hinge. Now I could bend lower, but that's where I lose contact with the back here. And what that suggests is I'm rounding at my low back, which is not what we want. When we do the hinge, we want that neutral spine, and if we go too low, there's going to be too much movement in the spine, which again becomes a problem if you start adding too much weight to it. So make sure you stop the minute that you feel that tension in the hamstrings and don't go too low. The next one that can happen, and again, this is more common in people who are very flexible. So I'm not that flexible, so it's a little bit hard to demonstrate, but it's nice with the pull. But what you're going to do is, again, when you reach your hips back, if you're really kind of hypermobile, hyper flexible, what can happen is you can kind of overextend at the back. So with this one, I lose contact in my mid back, and you overextend the spine, and I can already feel it in my low back. So you want to make sure that you keep your rib cage down, keep that contact on the middle back. And again, if you're having a hard time doing that, sometimes just a little brace, not squeezing as hard as you can, but like a 25% brace and the abs can help that. And the very last one, again, it's another one that's really subtle, but it can contribute to low back pain if you're feeling low back pain when you hip hinge. And that's when people reach their hips back, they start by rocking their pelvis forward. So instead of just reaching my hips back like that, I rock my pelvis forward and then I reach back. And the minute you rock your pelvis forward, you kind of overextend at the low back, and I can already feel it right there that again, it could become an issue if I start to add any sort of weight to that movement there. So those are the top 5 mistakes people make when they hip hinge. I'm Dr. Carl Baird. This is Performance Healthcare Online. Thank you so much for watching.